My name is Olivia Bernon, and today in this presentation, I will be talking about operations issues in healthcare. First, we need to know what healthcare operations management is and what their responsibilities are. Langevere and Helton outline healthcare operations management as the management that supports business and clinical systems and the processes that transform resources into healthcare services or inputs into outputs. Some of their duties include focusing on efficiency, using quality improvement techniques, supporting the business and clinical systems, and looking at the inputs and the outputs of the business. Some examples of inputs can be resources such as equipment, technology, and information, and outputs can be the production and delivery of healthcare services. Operations management is important because the key functions and responsibilities they have to help keep the facility running smoothly for the staff and the patients. Some of the key functions can include the physical layout, staffing levels, workflow, quality management, and productivity management. Operations issues can affect many different parts of the healthcare system. Some categories of issues can be organizational, financial, physical layout, staffing and productivity, and capacity design and planning. Let's talk about some examples of these issues from Langevere and Helton. For organizational, an issue that operations managers might come across is if they can improve speed and patient satisfaction. For financial, an issue can be if they can improve the revenue cycle metrics. For physical layout, managers can take a look at how the facilities are designed and if they can accommodate capacity and traffic flow, and if they operate efficiently. And lastly, for capacity and design and planning, managers can ask themselves if they should increase the use of technology to improve labor productivity. For this presentation, the operations issue that I will be talking about in healthcare is long wait times and the effects that they have in the healthcare facility. Long wait times negatively impact patients and staff, can further delay appointments, and be caused by many different things. For example, if a patient shows up to their appointment late, that can throw off the appointments for the rest of the day and cause the doctors and nurses to run behind schedule. Another cause could be if a doctor or healthcare provider is working on writing down notes for charts, it could take them a while. Then they would see their next patient later than scheduled. A third example could be in the emergency department. If there are many patients that need to be seen and not enough staff, patients will unfortunately have to wait longer because there are not any healthcare providers available to see them. Long wait times in healthcare can negatively affect patients, healthcare providers, and even lab workers. In an article written by Charlie Peterson, she outlined a number of different effects that long wait times can have on patients. The first of those being physical and emotional stress, which can worsen health conditions physically and mentally, and the waiting can cause stress and anxiety. Long wait times can also have a negative impact on relationships because families or caregivers that are responsible for taking a family member to their appointment, it can be emotionally draining for them to have to wait a long time. Injury or illness progression, because if a patient has an injury and they're not able to be seen right away, their injury or illness could get worse in the time that they're waiting to be seen. Lastly, decreased patient satisfaction, because long wait times have been associated with worse patient experiences. Peterson also listed impacts of long wait times on healthcare staff. The first of those being the financial impact, because if there are not that many patients that are being seen in a day, employees may face financial stress due to lost wages. Another example is reduced productivity, because employees that face long wait times may become disengaged with their work. A third negative impact on healthcare providers is reduced work-life balance, which can be a challenge in healthcare itself, but it can also lead to burnout and a decrease in job satisfaction. The last impact is decreased job satisfaction, because some employees may not like the fact that they themselves or patients are experiencing long wait times, and that can lead to employees leaving their jobs and higher turnover rates. So, what changes can be made to reduce wait times in healthcare? In an article by Stuart Gandalf, he compiled a list of 14 ways to reduce patient wait times, and today I will be talking about 6 of them. The first change is developing a policy for patients that are late or that don't show up. A policy can be put in place stating that patients who are more than 15 minutes late for their appointments will not be seen and will have to reschedule for another day or time. And then a policy for patients that can be made who don't show up. Those patients may have to pay a fee for missing their appointment. Another change in healthcare facilities can be offering digital check-in services so that when a patient arrives for their appointment, the receptionist may send them a link that will get them checked in, and they can electronically sign any paperwork that needs to be filled out. A third example would be sending patient appointment reminders. Some doctor offices may send text or email reminders in the weeks or days leading up to a patient's appointment so that they won't miss it. Another change that operations managers can implement is offering virtual health services. This was very popular during COVID when patients could not come into the healthcare facilities. Their healthcare providers would set up a video chat and help them that way. And if there are any patients who may not be able to physically come in for their appointment, healthcare providers can see the patients virtually so that they are able to get the help that they need. Conducting patient surveys can help make a difference with long wait times, because Gandalf stated that 30% of patients have left the doctor's office because they were unhappy with the long wait time. If patients are experiencing long wait times or any other issues in the healthcare facility, they can be provided a patient satisfaction survey so that healthcare managers can understand any issues for the patients and make the necessary changes. The last issue that could be made is scheduling a physician's assistant or a nurse practitioner for non-urgent visits. Especially if a doctor has been busy with many appointments, PAs or nurse practitioners can help with the workload and see patients for non-emergent issues that they may be experiencing. If healthcare operations managers want to make changes to reduce wait times, a plan is important. Plans are important because they are a necessary function in management, and it's important to note that plans are a continual process, and important team members should be included, and an SWOT analysis should also be conducted when creating the plan. As stated in Langabeer and Hilton, an effective operations planning process has 4 primary phases: analyzing operations in the environment, generating strategic alternatives, deploying the strategies, and then measurement and review. Coming up with a team to create the plan is important because healthcare facilities work with many different people and businesses, and most of the people who will be affected by the change should have a role in the planning process. The SWOT analysis is a combination of the organization's strengths, weaknesses, opportunities, and threats, and this analysis process allows the planning team to look at all aspects of the healthcare facility and can help them to create positive changes in certain areas. Management decision-making is an important process for healthcare because, as Langabeer and Hilton state, decision-making is a process and it reflects the major processes involved in managing the work of organizations. Decisions can be described as a choice between 2 or more alternatives or an action taken as a result of a process. If operations managers want to make decisions on changes that can be implemented to reduce long wait times, they should have an understanding of the decision-making process, which it is a 3-step process. Decision-making is rational, organizational, and political, and the process can be routine or complex. The 3 steps in the decision-making process is: number 1, finding occasions to make a decision; 2, finding possible courses of action, and 3, choosing among many options. Langevin and Helton describe how decision-making can be rational, organizational, and political. When talking about decisions being rational, it suggests that decisions are made in a logical or systematic way, and this process minimizes decision outcomes and adjusts for risks. For organizational decisions, that can be described as choosing a decision that meets the criteria and is able to be implemented quickly. For decisions to be political, that means certain decisions were made by individuals trying to achieve their own personal goals, and these decisions are often biased and made on emotions. Sometimes decisions can be routine or complex, and Langevin and Helton note that routine decisions are associated with selection and evaluation methods and can be automated, and for complex decisions, they are less likely to be programmable and are based on intuition or judgment. Overall, it's important that healthcare operations managers have an understanding of the planning and decision-making processes and how long wait times can affect healthcare facilities. Operations managers can use the proper tools to create changes to positively impact the patients and the staff.